Hey everyone, this is Kenton Sefcik, registered acupuncturist, and this is TCM Graduate TV. Today, on episode 1, I'm going to review one of the key or command points, large intestine 4. Today we're going to review large intestine 4, one of the key or command points for the head and face. There are 4 principal key or command points, and if you're classically trained in China, there's actually 6, and we're going to go through all 6 of those in this series. TCM, or traditional Chinese medicine, has 2 things in my opinion. One, it's a conglomerate of disciplines or modalities such as acupuncture, herbs, cupping, moxa, Tuina massage, etc. Qigong, Tai Chi. The other thing that TCM has become is it's almost become its own style of acupuncture that we learn and teach in the colleges. Key or command points takes this to the next level. If you're working in the area of the head and face, you can add large intestine 4 in to make your treatments more effective. How this works is based on channel pairing. If you can think of the time that you learned a little bit of the Shanghan Lun, or the 6 stages of cold damage, talk about the Yongming. We talk about Yongming pairing. The stomach actually pairs with the large intestine. Both are Yongming channels, and that is where the most qi in blood is contained. There are a lot of stomach channels on the face. And if you had the opportunity to study any tan or tongue acupuncture, you'll learn that a lot of the time, the way we come up with acupuncture points is based on metaphors for our own body. Treating the head, which is kind of encompassing of the core, is treated as we move down along the limb. So your hand, as Dr. Tan talks about being the puppet show, the hand is the head, the wrist is the neck, this is the upper body, the middle of you, and the lower body. And when you get to the shoulder, it's the genital area. The same thing to be said with the foot. So the foot is your head, and as you move up. So this gives a good indication on A, how acupuncture points were developed, and B, how some of these command points work. So because there's a lot of stomach channels on the face, you can treat metaphorically using the hand with a Yongming pair, and you can use the large intestine channel. Now, that gives us a good indication of how maybe these key or command points were developed and why they're so powerful. But really, what we're looking for in traditional Chinese medicine is almost like the combinations, right? The combinations of acupuncture is what makes it so powerful. So I want to give you those because those are the clinical pearls that you'll be using on a day-to-day basis. So when I think of large intestine 4, I think of 4 or 5 good combinations that I can use it with. I'm just going to abbreviate here, so WC will be wind cold. So to treat wind cold, first we need to get rid of the wind. So we're going to use GB20. We're going to throw in our Li4 and then our Lung 7. So that's a really good combination. If you have anything else going on, such as phlegm, you can do a spleen and stomach 40 combo, which we'll get into later. But this is a really, really good jump-off point for wind cold. Wind heat. Same idea. We want to get rid of wind. So I'm going to use my GB20. Next, I'm going to use my Li4, and I'm going to throw in a triple warmer 5, or a Sanjiao 5. This is really, really good for wind heat. Next thing I want to discuss is TMJ. If a patient exhibits pain through the mandibular joint, what we can do is, again, a combination, almost like a symptomatic grouping. And what we're going to do is we're going to do stomach 6, stomach 7, and then large intestine 4. One of the other things that I think about when I think about large intestine 4 is hand pain. I've been in practice for 9 years now, and I recall a story that I've told many times about an 80-year-old patient who was unable to play the piano anymore. And he came to me, and through the guidance of my instructors and again TCM combinations, they told me to use large intestine 4 and small intestine 3. This is a great combination for any kind of hand pain. If there's hand pain elsewhere in the hand, you can use this as a kind of a principal jump-off point, and then you can add in other acupuncture points, such as Yao Tong Dan on the back, or any other acupuncture point that you see fit, maybe for a specific joint. But this is a very good jump-off point. Last but not least, I want to mention the 4 gates. This is a large intestine 4, liver 3 combination. I have quite a few years experience in the martial arts, and if you've seen some martial arts movies, oftentimes there'll be a battle in the courtyard. And oftentimes a courtyard has 4 entrances into it. Big, tight, moon-based doors that almost look like gigantic windows that people go in and out of, that might have doors attached to them as well. So in my mind, if we were to open all 4 gates, we would let anything and everything flow freely through the courtyard. This is very similar to the 4 gates, in which we say, kind of the poem or the saying is, it opens all channels and collaterals. If you have a patient that's suffering with pain, any kind of pain, pain all over the body, such as fibromyalgia, this is again a very good combination. One thing I'd like to mention about large intestine 4 quickly is that it is one of the 6 contraindicated points for pregnancy. We can't use it until a patient is at 37 weeks, which is considered full term. And we'll go through some of the other contraindicated points as we go along, and we'll keep mentioning them, but I just want to write them down here. So we have large intestine 4 and spleen 6. Those are your 2 big heavy hitters. These are actually excellent at 37 weeks to help ripen the cervix and cause minor contractions, and hopefully bring on pregnancy around that 40-41 week mark, so that the patient hopefully doesn't have to become induced. So Li4, spleen 6, GB21, stomach 12, which is just in front of GB21, UB60 and UB67. UB67 can safely be used to turn malposition of fetus. Of course, we're using Moxa to do that. I hope that this becomes some help to you, and that you can start using some of the combinations to get results in the clinic. I just want to remind you of 3 more things: that safety is king, bedside manner is king, and results are king, in that order. Thank you so much, and we'll see you next week.